Hello, everyone. Welcome to our webinar for this day of the Exchanges Week. My name is Erwin Barboza. I am the current SCORI Director for the 2018-2019 term. I am joined by two of my amazing SCORI International team members who will be introducing themselves. Guys, would you like to say some words?
Hi everyone, my name is Matthew and I'm a member of the SCORI Supervising Board.
Hey guys, I'm Javier from IFMC Honduras and I am the SCORI External Development Assistant, and I really hope you can get a lot of new knowledge from this webinar and you can apply all of these new actions and take action in your own place, locally, nationally, and even internationally, so that we can all achieve open access.
Okay, thank you so much. Now, as we move on to the presentation, I want to thank you all for coming. Please remember that you can use the questions, like the comment section, as a question place. So if you have any questions during the presentation, feel free to write them down and we'll try to answer them for you as soon as possible. So we will be starting. So our topic for the day has to do with a really, really great topic, especially for those of you interested in research. It's open access, myth or reality? And as we all know, this is a really, really important topic because it has to do with one of the newest trends of publication systems. And so we'll try to give you some more insight as to what this is all about and what can you do in order to apply it not only locally, like Javier said, but also maybe even nationally or internationally. So here we go.
Yes, so today's webinar, as you heard, is part of the IFMC Exchanges Week 2019. The Exchanges Week is a week organized by Scopy and SCORI to raise awareness about exchanges and about all the topics surrounding it. Today we are at day 5, and the topic of the international level is open access, which is a very important topic and is also a movement that is growing every day. So today we will talk about firstly the IFMC global priorities, then about open access and research education, which is an IFMC global priority. Then what open access is exactly, the benefits from open access and who gets benefits from it. We will also talk about the policy document on open access. Then we will talk about how achievable open access is and what has been done so far. And we will finish by how you as a student can contribute to open access and the IFMC call to action surrounding open access. So first, I will leave the floor to Javier to talk about the IFMC global priorities.
Thank you, Matthew. So when we talk about the IFMC global priorities, it's a term that most people in IFMC heard, but mainly most people tend to not understand what they are exactly, or how does they work, what were they created for. So basically, when we talk about global health, we know it's endless opportunities and topics that IFMC can work on. And when we want to assure like the biggest impact that our federation can have like worldwide, we decided to select a group of global priorities so that we can focus all of the internal work we do in the NMOs and the external representation we get from them. So basically, the global priorities are a group of focus areas and overarching concepts in which the internal and external work in IFMSA and its standing committees will be focused on. And this will help us have a streamlined and a strategic approach towards our deliveries on a global level. And it also helps us to act as a guidance to ease up our daily collaboration between the different working groups in IFMSA. I mentioned two terms before, which are the focus areas and overarching concepts. What are the differences between them? Can we move to the next, please? So as you can see, IFMSA has 10 focus areas and 3 overarching concepts, but what are they specifically? When we talk about the focus areas are specific topics or areas, as the name mentions it, where each standing committee can make actions and can have initiatives and projects implemented in order to achieve or to work towards them. So, for example, when we take non-communicable diseases, it's one of the focus areas worked on by the Standing Committee SCOF, the Standing Committee on Public Health. When we talk about access to research and research education, as you can see there, it's one of the focus areas on which SCORI, our standing committee, is working on. And what are the overarching concepts? The overarching concepts basically are topics or focus areas, well, not focus areas, but concepts that are not specifically limited to a standing committee per se, but all of the standing committees and all of the working groups and partners in IFMSA can work towards on. So the overarching concepts we adopted for the term were global health education, meaningful youth participation, and universal health coverage. And as I mentioned to you before, the focus areas in which our standing committee is working on is access to research and research education, which has some internal goals and external goals. And Erwin is going to help me explain more about the internal goals we have within it.
Yes. So in order to talk a little bit about our global priority, which is access to research and research education, and before we go into the internal goals, I think it's really, really important to talk about a little bit of the background of our current global priority. Um, in it, we believe that research is the core of scientific and medical development, and that medical students need to gain a certain set of skills in the field of research in order to meet the needs of their patients and the future needs of their communities. However, we realize that many medical students are not exposed to research through their medical curricula, and this, of course, can affect their future ability to appraise articles and to conduct research projects. Our mission is to offer future physicians an opportunity to experience research and diversity in countries all over the world so that they can become both culturally and scientifically sensitive uh, future healthcare workers, um, helping out in the shaping of the world of science. So with that in mind, we have set ourselves some internal and some external goals. From our internal goals, you can read it in the screen. First one is to increase the awareness for the importance of early exposure to medical research for medical students through campaigns, promotions, and other means. To develop educational activities and other tools to directly help students learn relevant research skills with the end goal for students to be able to start and lead their own research projects. To build capacity of research exchange officers to improve their knowledge and competency of academic quality in order to enhance the research education and exchange student receives on exchange. And last but not least is to increase the access to research exchanges by increasing the number of seeking new opportunities for non-active NMOs to be involved. Now for the external goals, Javier will be letting you know about them.
Yep. So once again, how this works is all the internal goals, when we are achieving them, we want to express this to all of our partners, to our collaborators, so people can actually see what are we doing as a federation. That's why we created the external goals. And as you can see them on screen, we have 3 external goals for this global priority. The first one is to strengthen IFMSA's global presence in the open movement, and in particular open access, open data, open research, and open education, by actively supporting the OpenCon, Open Access Week, and preparing useful resources for IFMSA members, including a policy document. The second one is to pursue recognition for SCORI activities such as the research camp by respected organizations working on research education. The third one is to seek new partnerships with international and/or regional organizations facilitating students' access to research. And as I mentioned in the first external goal, we wanted to include and create a policy document that talked about access to research and research education, which is a policy document we created and we adopted recently in the IFMSA March meeting in Slovenia. And If you can go to the next one. And you can access these policy document. You can search for it in Google. Just search it as IFMSA policy documents, and then you can search for this one. And basically, the IFMSA recognizing the importance of research for universal health coverage and the progress of society, it affirms its stance that medical students everywhere should have access to research and research education during their undergraduate studies under the proper guidance of experienced tutors. This should include, of course, ethical practices and benefit versus harm, evidence-based medicine, understanding and being able to employ research methodologies, capacities to read and interpret research findings in scientific papers, as well as develop the critical thinking and academic writing skills as future health professionals. Also, our federation affirms that research with minimal resources should be included in the curricula worldwide, not only to develop ingenuity among students, but also to provide students with the right skill set to execute scientific activities when funding and resources are scarce. So moving on and advancing in this global priority, we want to introduce you to a concept called open access. What is open access precisely? What is open education, open data, which is the topic for this webinar. So when we talk about open access, we mean the free, immediate availability on the public internet of all those works on which scholars give to the world without expectation of payment. Basically, all of the research papers and investigations being made worldwide when they are permitted to any user to read, download, copy, distribute, print, search, or even link to the full text of these articles, crawl them for indexing, pass them as data to software, or use them for any other lawful purpose. Basically, that is open access. Why is this important? You know that our current system for communicating research uses a print-based model in the digital age. And even though research is largely produced with public dollars by researchers who share it freely, the results are mostly hidden behind technical, legal, and even financial barriers. These artificial barriers are maintained by legacy publishers and restrict access to a small fraction of users, which, you know, it's basically locking out most of the world's population and preventing the use of new research techniques. This fundamental mismatch between what is possible with digital technology and open system for communicating research results in which anyone, anywhere can contribute, and our outdated publishing system has led to the call for open access. Now, who benefits from open access? Is this really sustainable? Can researchers, can students benefit from it? Can even libraries and journals benefit from it? And it's important to mention that open access truly expands shared knowledge across scientific fields, and it is the best path for accelerating multidisciplinary breakthroughs in research. This is from an open letter to the US Congress signed by the Nobel Prize winners. And really, it's the benefits from open access. If you can move to the next slide, they are huge because, for example, the research it provides the foundation of the modern society. It basically leads through the breakthroughs, and communicating the results of research is what allows us to turn breakthroughs into better lives, to provide new treatments for diseases, to implement solutions for challenges like global warming, and to even build entire industries around what were once just ideas. Can you go to the next one, please? And I really like the next image because it summarizes the most the biggest benefits from open access. And the first one is obviously more exposure for your work. When you do a research project and then you publish the results through open access, then you get more exposure because students like you and me wouldn't have to pay to read those results, to pay for new science, for new knowledge, which we will need for our patients. Also, practitioners can apply these new findings during their daily hospital lives. We can get higher citation rates. The research can influence policies. The public can access our findings. We can comply with grant rules. We can make taxpayers get value for money, and mainly researchers in developing countries can see your work, which is a specific case I have seen, at least in my country, where when we want to look for new scientific discoveries and new research projects, we find this financial barrier that in order to see these new discoveries around the world, we would need to pay for these articles. And if open access was really implemented, then this would remove this barrier and make science available for everyone, which, next please, which is one of the four fundamental rules of open access, and not only open access, but of course of open science. And the first one is transparency. The results, everything is shared basically. The next one is accessible to everyone, the science. And the last two are basically being available and being free for everyone. Also, IFMSA, we have a policy document on open access. This was adopted during the IFMSA August meeting in 2017 in Tanzania. And basically, committing to making high-value scientific knowledge accessible to researchers, scientists, entrepreneurs, and policymakers, it's such a major step towards better health outcomes for all. And over the past decade, you know that open access, open education, and open data have become central to advancing the interests of researchers, scholars, students, businesses, and even the public. Yet, when consulting academic journals, students face limited access to published research output, data, and papers because of the very high fees. Us, as a federation, we firmly believe in the importance of openness across all published research outputs, and thereby IFMSA believes in the ability of openness to improve the educational experience, democratize access to research and education, advance research and education per se, and improve the visibility and impact of scholarship. That's why we support open access, open education resources, and open data.
So now we're going to move on to the second part that after, about open access and what is it about, we can finally ask ourselves, is it truly achievable? Is open access a possibility anywhere around the world? And so before I answer that question, I want to give you some basic information of how achievable or how the process seems in comparison to a normal type of publication. And based on that, I can tell you that the process of publication in open access journals is pretty similar to the ones in non-open access organizations, for which is not much different for tutors or researchers to actually publish in these journals or in these websites. In some countries, even, you will find that the cost of publication, which in comparison to those non-open access journals is quite reduced, is that in some cases, some countries will actually reimburse you if you decide to publish in an open science journal. In some cases, or in most cases, actually, the organizations that help in this publication of open access articles and material have solid research backgrounds. Some of the people in charge of edition and peer reviewing are very experienced researchers from multiple fields. And of course, they count on proper financial backing for the platform to continue and to be maintained. So is it achievable? Yes, definitely it is. But of course, there are some situations that you should be aware of. If open access can truly be applied everywhere, and in order for you to know whether it's applicable to you or not, we encourage you to do your own research about open access in your own country and how it works. And also be on the lookout for journals that have a certification of open access. And of course, all platforms that are provided to you, most of them may be true and may promote open access truly in a legal way. But of course, you should also be aware of the so-called pirate websites and pirate journals that can take can say that they are part of an open access journal, but instead you will be giving them your research, and then that could be used or could be plagiarized. So definitely with the right tools and with the right organizations, open access is not only achievable, but also highly encouraged for benefits that Javier has already mentioned. And also considering that the trend worldwide is increasing towards open access publication. In order to continue on that, I'm going to go to what has been done regarding open access. In the IFMSA, like our global priorities state, we have created sessions and capacity building sessions, not only in person, but also online, on what open access is and its importance. Also, we have launched campaigns such as this one and others in which we stress the importance in the realistic opportunities that open access can provide to students worldwide, and of course to researchers of all levels, and the promotion of policy documents that, like Javier of course showed, there are two that are very important for this matter, for this topic, that are the open access policy document and the access to research and research education policy document. Now, what has been done worldwide outside of the IFMSA? We have realized that open access has gained power as a discussion topic, and nowadays, the moment that you search for open access on the internet, you will be able to see multiple news sites commenting on the topic and giving articles of opinion and multiple information on what has been going on about open access worldwide. Also, we have seen organizations and universities starting to support open access publicly and completely. Two very important cases, such as the University of California in the United States, that has decided to stop using non-open access resources and decided to move towards an open access database and ecosystem for their publication of research, and organizations such as the European Commission that has launched the Horizon 2020 campaign, which was launched in 2014, and it's encouraging countries from all over the European Union to join and promote open access in their countries and in their education systems. Last but not least, we have the increasing financial and logistical support for the platforms. We have seen a steady increase of open access articles, especially in the European Union, but other countries and other regions of the world are also starting to catch up. And we see that the trend is going towards a positive situation for open access. We see more countries joining and more countries increasing their percentage of open access publications. So we believe that this trend will continue and will eventually reach a moment in which open access is going to be the main way of publication and the main way to access research worldwide. So now on how can students contribute?
Yes. So there are actually many ways that you as a student can contribute to open access. In fact, students have already been very important in lobbying for policies about open access at a national level, but also on a local level in major universities. A very simple way of taking part in this movement is to take part in the International Open Access Week, which this year will be hosted in October from the 21st till the 27th. It's an initiative of SPARC, which stands for the Scholarly Publishing and Academic Resources Coalition. And during this week, awareness on open access is created through hundreds of local, national, and international events. And the most important thing is actually to participate. And you can do this in many ways. For example, by organizing a viewing party of one of the many webcasts that they share during this week, or by writing an opinion piece in your campus newspaper, or simply by sharing their Facebook and social media pages. Another important player in the open access community is the Right to Research Coalition, which is an alliance of student organizations all over the world. And they work on promoting openness in research. As an individual student, you can support them, but also as a whole student organization, you can join this coalition and take part in advocating for open access, both in your universities on a local level, but also on a national level. Spark and the Right to Research Coalition also co-host OpenCon, which is a conference that happens every year. And they try to empower students and young professionals to advance open access, open data, and open education. You can go to this event, of course, but if you cannot attend, you can also join them remotely because they have a lot of webinars and webcasts, as well as live discussions you can take part in. But there's also many satellite events, maybe in your region, that you can join, or you could even create a satellite event yourself. As was said, you can also advocate for open access on a local level in your faculty, but also have an impact on a national level. So one way to do this would be, for example, to create a campaign in your university to adopt an open access policy. And what an open access policy actually means is that your faculty would then require all the research on your campus to be publicly available. And for example, you could set up a table in your university and talk to all the students and the staff members about why open access is such important, and make them sign such a policy. But of course, the first step is to implement open access in your own life. So for example, if you or the research group you're in is publishing an article, please publish them in a journal that is openly accessible. Next slide, please. Yes. So as you heard, we have a policy document on open access. And in this policy document, IFMSA has a call to action ready. And these are all action points that we write down. And they summarize everything we would like from, for example, governments or medical schools, or you as a medical student to do in order to achieve open access. So I will briefly go over these points, but I will focus mostly on what organizations and medical students can do. So first, the IFMSA calls governments to adopt policies about open access. The next point is about funding. So we also call the governments to only fund research that is made publicly available. And we also call them to invest in open educational resources. The IFMSA also calls universities and medical students to adopt these policies on a more local level then, so that the research is made publicly available. We also call universities to then reward the researchers who make their research publicly available instead of having them in journals that are very expensive. We also ask to use open source software that is free instead of the very expensive software. And just with the governments, we also ask to use and to create open educational resources. Next slide, please. Yes. The IFMSA also calls researchers, as was told previously, to publish their articles in open access journals. Sometimes that is not possible, and then you can, for example, publish the article in a repository that is available in your university or country. And we also ask researchers to use materials that are free and open source instead of the very expensive software and learning materials. And finally, the IFMSA also calls NMOs and medical students to support and to create awareness regarding open access, open data, and open education. We also call organizations and students to join the Right to Research Coalition, which is a very big coalition. And they organize a lot of projects and they give a lot of tools to create awareness about open access. We also call students to ask their the researchers in their university to publish the articles in open access journals or in repositories in their university. And finally, we ask organizations and especially students to use the voice they have in order to advocate for open access. And also with this sentence, I would like to end, because as a student, you have a very crucial part and you have a very important voice in order to create projects in order to create awareness about open access, open data, and open education, as it will improve our education.
Great. Thank you very much, Matthew. Now we open the floor for some questions of yours. And meanwhile, you're writing them down, or maybe you have them ready. I want to give the word to Javier, who has a little bit of a heads up to all of you attending this webinar.
Yes. So I wanted to mention, for the ones that don't know, or maybe are new to SCORE, or maybe just forgot, besides just doing the research exchanges and carrying out the program, we also have some educational activities that were created and started being implemented since last term. These educational activities are three. The first one is a research camp, um, which was done last year, and we will have a second edition this new year, which we highly encourage you to apply and to attend. The other one is a training on basics in medical research, and the one I wanted to mention and try to explain a little bit further is an open science educational activity. We have materials for it. We have PowerPoint presentations. We have a document explaining all of the presentation and from where we got all the information and the bibliography and background for it. So that's one of the ways how you can advocate for open access by carrying out this educational activity, for example, in your university, or making it implemented in your NGAs, in your NMOs, for example, as giving it as a specific session. So if you want, you can approach us, the IT, just send us an email, and we will share with you the materials, and we will see how to help you coordinate this educational activities so we can start creating this impact in our local and national levels.
Okay, awesome. Thank you very much, Javier, for giving a heads up. I do not see any questions. So I guess we're going to wrap up. And of course, if you have any questions after watching this webinar, for those of you that are not watching it live, feel free to approach us at any time. Us members of the SCORE International team, we're more than glad to help you. Of course, here you have Javier and you have Matthew that have been working on this webinar. So please approach us by email and we will gladly get back to you with more information of how you can make this a reality in your NMO, in your LC, or maybe even in your own life. So that does it for the webinar. Thank you very much for attending it. And thank you very much, Javier and Matthew, for joining me in delivering this webinar. And yeah, keep enjoying ExWeek, and I hope to see you guys around very, very soon.
Thank you, guys. Goodbye.
Thank you very much, guys. See you soon.